Auscultation of the heart is a fundamental skill in medical practice. By listening to the heart sounds, healthcare professionals can gather important information about the functioning of the heart and detect any abnormalities. The first heart sound, often referred to as S1, is produced by the closure of the mitral and tricuspid valves. It is a low-pitched sound that marks the beginning of systole, the contraction phase of the cardiac cycle. The second heart sound, known as S2, is caused by the closure of the aortic and pulmonary valves. It is a higher-pitched sound that signals the end of systole and the beginning of diastole, the relaxation phase of the cardiac cycle. In addition to S1 and S2, there are other heart sounds that can be heard under certain conditions. These include S3 and S4, which are abnormal sounds that may indicate underlying heart conditions. Auscultation of the heart is typically performed using a stethoscope. The healthcare professional places the stethoscope on different areas of the chest to listen to the heart sounds. Each area corresponds to a specific valve or chamber of the heart. By carefully listening to the heart sounds, healthcare professionals can detect murmurs, abnormal rhythms, and other signs of heart disease. This information is crucial for making accurate diagnoses and determining the appropriate treatment for patients. In conclusion, auscultation of the heart is an essential skill for healthcare professionals. By listening to the heart sounds, they can gather valuable information about the functioning of the heart and identify any abnormalities. Don't forget to subscribe to our channel and like this video for more informative content.